Welcome to AETCM, the emergency medicine channel. Today let us discuss about axis of the ECG. You know that axis is not that important in ECG reading, but if you know about axis, it will be good. Like there are some rare conditions where axis may be useful. Slide is not there now. Okay. So now we'll see what is a normal axis. Normal axis in your ECG, that is a QRS axis, is between -32 plus 90. -32 plus 90. You can see here -32 plus 90. So this is the normal axis of your ECG most of the time. Left axis deviation is less than -30. This is the left axis. This green one is left axis deviation. We will see all these things in detail afterwards. Right axis deviation of QRS axis is more than 90. This is RAD, is right axis deviation. Okay. Then extreme axis deviation, extreme right or left. Sometimes it is called as northwest axis, in between left axis and right axis deviation. That is -90 to plus 180. Now we will see the easiest method to identify the axis of a QRS complex in an ECG. The most efficient way to estimate the axis is to look at the lead 1 and AVF. In your ECG, you can see here 1 will be there, lead 1 will be there, 2 will be there, 3 will be there, and AVF will be there. That will be the normal arrangement in your ECG paper. So look at the electrical activity in lead 1 and AVF. So if normally 1 and AVF will be positive, 1 and AVF, and that will same thing happens to lead 2 and lead 3. Normally this will be positive. So that is a normal axis. If all the leads it is positive, it is a normal axis. Now if lead 1 is positive, lead AVF is negative, then it is left axis deviation. Look at here. One is positive, AVF is negative. Okay. So here also mostly if AVF is negative, here also it will be negative. So 1 is positive, AVF is negative, then it is left axis deviation. Whereas 1 is negative, AVF is positive, then it is right axis deviation. So you can see here 1 is negative. The QRS voltage, total voltage we are telling, so it may be something like this, R Q S, okay, or R S, okay. So that is one is predominantly negative and AVF and both it is positive. That means it is left axis deviation. In extreme axis, both will be negative. This will be negative, 1 will be negative, AVF also will be negative. So we will see examples for each of these things. Now look at this ECG, look at 1, lead 1, that is positive here. Lead 1 is positive, that means P, QRS is like this, positive. Okay. So that is positive here. You look at AVF, that is P, QRS. Okay, that is also positive. QRS is positive here, QRS is positive. Both are positive. Since it is both are positive, it is normal axis. You can, instead of taking AVF, you can even take 3 also. The same change you can see here. So both 1 and 3 will be positive deflection. Okay, both will be positive. That is normal axis. Now look at this ECG, two ECGs, right axis and left axis. Right axis is, in one it will be, look at this, predominantly it is negative. Predominantly it is negative. Here look at AVF, it is predominantly positive. Positive. So you can just remember like this. This is the center. Instead of taking AVF, you can even take lead 3 also. I already told same pattern you can see here. This is the center. If you take 1 and 3, this is the center. Okay. So they are reaching towards center. Reaching towards center. That is right axis deviation. Reaching towards center. That is right axis deviation. So this is negative. This is positive. If you draw like this, they are reaching towards the center. Okay. So reaching towards center is right axis deviation. Whereas this one you see, one is predominantly positive, AVF is negative, here also it is negative, lead 3 also negative. Now you can see here, this is a central area. They are living away from the center. So this is reaching towards center. That's why we can remember it like that. Right axis deviation. Right axis deviation. This is left axis deviation. So right axis and left axis deviation. The easiest way to identify right axis and left axis is in 1 and 3. AVF also can be taken. 1 and AVF or 1 and 3. They are reaching towards center. The QRS morphology is predominantly negative here, positive here. So they are. If you draw like this, it will be reaching towards center. Whereas this QRS is living away from the center. So QRS in V1, lead 1 is like this, lead 2 is like this. So they are living away from the center. So that itself will tell you what is the axis. Oh, what are the causes for right axis and left axis? That is very important, but we will not learn all these things. You can read all those things, but LVH produces left axis deviation, that is left ventricular hypertrophy. Right ventricular hypertrophy produces right axis deviation. It is very simple that. So in a patient whose heart is like this, so it's a normal axis. If you have a left ventricular hypertrophy, so heart will turn to that side because the hypertrophy is here, left side. So this is left axis deviation. The axis is deviated. So normally current goes in this direction. Here it is turned to left side. Now in right axis it is just opposite. Right ventricular hypertrophy. This ventricle is thickened. So heart will turn to this side. So when the current goes, it will go like this. Instead of going like this, it will go like this. So this is right axis deviation. So the most common cause for axis deviation is left ventricular hypertrophy and right ventricular hypertrophy. Same like that, you can think about LBBB here and you can think about RBBB here. Okay. So many conditions we have mentioned here, you can read that. But remember, the most common cause for axis deviation is LVH and RVH. That you should remember. Okay. Should not forget about axis deviation RVH, that is right axis deviation, and LVH, it is left axis deviation. Now there is another method, that is isoelectrical lead, and with that lead you can find out the axis. Okay. In that method, it is a better method than the previous one, but it is little complicated. If the QRS is positive in any given leads, okay, so you can see here any given lead means these are the leads. AVR is always negative, so we don't discuss that. Any of these leads, 1 AVL, 2, 3 AVF, the axis points roughly the same direction as this lead. If the QRS is negative, any of the given lead, the axis point roughly opposite direction of the lead. If the QRS is isoelectric, that is a little, so if all these things are positive, then it is, you can see here, all things are positive, then it is the same direction, that is the direction is here, left or right, and if it is negative, then it goes to the opposite direction. Okay. And another method is isoelectric method, that we will see in detail next slide. In isoelectric line, the step 1, is find out the isoelectric line, isoelectric QRS complex. This is isoelectric QRS complex. In any of these leads, you find out which one is more isoelectric. That means any leads 1 AVL, 2, 3 AVF, if the QRS complex is isoelectric, then take that. Step 2, find out the positive leads in that that group. Look for leads with tallest R waves or longest RS ratio. Step 3, calculate the QRS. The QRS axis is 90 degree to the isoelectric lead pointing in the direction of the positive leads. We will see the examples so that you will understand it. It is very difficult for somebody to learn it. Lead 2 is an isoelectric lead. So, this is an isoelectric lead. You get QRS complex like this. Okay. The QRS axis must be plus or minus 90 degree from lead 2. So, trace the lead 2. This is the lead 2. So, lead 2 is here, and this is the axis of the QRS here. Okay. 90 degrees. The more rightward facing leads 3 are positive. So, lead 3 you will see, where is the lead 3? Lead 3, they are positive, positive 120. And AVF is plus 90, while AVL is negative. So, the axis is somewhere here, we will see. This puts the QRS axis in 150. Okay, plus 150. This is an example of right axis deviation, but it is very difficult, so that you can see the other method, easiest method. QRS is predominantly negative here, QRS is predominantly positive here. They are reaching towards center, So, it is right axis deviation, reaching towards center, right axis deviation, or this is a difficult method. You can even follow this method to exactly find out where is the problem. Now, method 2, the other example, you can see the lead AVL is more isoelectric here. This is the AVL, the 90 degree mark. From the diagram above, we can see that the AVL is isoelectric, that we have already seen. The QRS axis must be plus 90 from lead AVL, either plus 60 or minus 120, plus 60 or minus 120, plus 60 or minus 120, somewhere here. Okay. With leads 1, 2 and AVF all are being positive, we know that the axis must be somewhere between 0 to 90. 0 to 90 means here. They are positive, somewhere there. That put QRS axis in plus 60, that is normal axis. Okay. See the first method, 1 is positive, 3 is also positive. So, it is a normal axis. Okay. So, that the previous method is always better for a beginner, but this method will give a precise or better view of the axis. Now, next one is left axis. Lead 2 is an isoelectric lead. Lead 2 is an isoelectric lead. This is a 90 degree axis. Okay. The more rightward facing leads 3 and AVF are negative. 3 and AVF are negative. 3 and AVF are negative. AVL is positive. This puts the QRS axis in minus 30. This puts the axis in nearly minus 30. Okay. And you know that when it is minus 30, it is left axis deviation. Now, apply the first method here. Take 1 and 3. They are living away from the center. Living away from the center is left axis deviation. The same thing is written here also, but here exactly you can tell the axis, it is less than minus 30. That is the only advantage. But we normally in practice, routine practice, it will not give a much benefit for the patient. Now, extreme axis is also like that. I am not explaining that because it is very difficult to understand for you, but whatever it is, if you can identify in this method, that will give you a better idea about axis. I will show some normal ECGs or with the axis difference. So, here look at this 1 and 3, both are positive, then it is normal axis, very simple. The second ECG, this is negative, this is positive, reaching towards center, right axis deviation. If you follow the other method also, it will be almost similar. Now, look at this. It is going like this, it is coming like this, leaving from the center, leaving away from the center, that is left axis. Now, left axis and right axis we have already explained in detail. Left axis, right axis, we should know, because LVH and RVH, and there are some other condition, LBV, RBV, LHV, all these things also you can get some axis deviation. So, we have discussed one small topic, how to identify the axis in ECG. If you understand the second concept, it is well and good, but if you do not understand, just remember like this: living away from the center, 1 and 3 or AVF, that is living away from the center, that is left axis. Or if it is like this, reaching towards center, 1 and 3 or AVF, that is reaching towards center, right axis deviation. So, that is very simple, left axis, right axis. But if you want to learn in a better way, you go for second method and identify the isoelectric line, isoelectric QRS complex, and see the 90-degree axis and see which all the leads coming in that area is positive. Then you find out the axis. Thank you.